A frequently asked question in spine clinic is, will my spine surgery leave me paralyzed? There are many patients who have seen or heard somebody who had a spine surgery and was essentially bound to the bed after the surgery. Because of these misconceptions or a few bad experiences, many patients are extremely scared about undergoing spine surgery and tend to delay their treatment out of fear. However, modern spine surgery is now quite safe. With the advent of microscopes and endoscopes, we get a very magnified view of all the vital structures, which makes operating in these vital areas safe. Surgeries are done under the supervision of neuromonitoring. With neuromonitoring, we actually map the status of your spinal cord and nerve roots, so we actually understand if we are creating any damage to your spinal cord. Cutting instruments and cutting tools have improved. You have good quality Kerrison punches, we have high speed drills, we have ultrasonic bone scalpel. Using these equipments, it's quite safe to make cuts in your bone without damaging the underlying structures. The ultrasonic bone scalpel has been a revolution. It is like a plaster cutter, so when you cut the plaster, it doesn't make a cut in the underlying skin. In today's era, the buzzword is minimally invasive spine surgery. With smaller cuts, endoscopes, and good equipment, the aim is to get you back on your feet as soon as you can. So, done in the correct way and with the right tools, you should be up and about after your spine surgery in no time. Thank you.